Hello, everyone. Thank you for joining us for another edition of Orthopod. My name is Mo Bandari, the editor-in-chief of Orthoevidence, and I'm here today with Professor Parag Sancheti, who is chairman of the Sancheti Hospital for Orthopaedics and Rehabilitation in Pune, India. I'm here, I wish, on slightly better circumstances, but I will let Dr. Sancheti explain to you what's transpired or what will be transpiring in India in the next few days. Parag, welcome and thank you so much for taking this on short notice.
No worries. Thanks, Mohit, for having me here. Well, the last 3 or 4 days in Pune or our state, the Maharashtra state, have been a little overwhelming. The number of cases saw an all-time single-day rise of 1,800 cases per day in Pune. And Maharashtra also has nearly 8,500 cases every day. And this has been a real all-time high in the last 2 to 3 days. Keeping this in mind, Pune, the authorities have decided to have another lockdown from Tuesday 14th. So in effect, from tomorrow will be the last day. It will be a very strict lockdown, Mohit, what they are planning. They will have only some of the medical shops open. The hospitals, of course, will be open. The grocery stores for the next 5 days will be closed. The petrol pumps, the petrol stations will be closed. And this is something which is really going to be a strict lockdown. And I was just thinking why they have done that. Number one is, of course, the number of cases have been an all-time high. But what they want to do is probably break the chain and give the healthcare systems, a chance to breathe. In Pune, I can tell you that the healthcare system is overloaded. It's very difficult to find a bed for a COVID positive patient. And what they have decided now, they're not admitting any asymptomatic patients and they're relying more on home care. But even then, the load is so high that there are no beds available. So also the government needs to add beds. They need to add oxygen systems to it and, get more ventilators. So they just probably want a break, and hopefully these total 10 days of lockdown, the first 5 days of which will be very strict, will help to kind of reduce the load, to break the chain, to increase the doubling time. That's what the health authorities in Pune are hoping. And that's
so let me ask you this. I mean, what do you think has been happening? Because, I think you and I spoke some time ago, not that long ago, and in which you were in another lockdown, and there was another lockdown, or it was just about to happen, or you were in the midst of one.
Yes.
And there was great optimism and hope that would have been enough to be able to curb what had happened. Do you know why the surge happened even, or is there perceptions as to what happened with this second surge? Because it seemed as though...
So what happened is... ever since we had the opening up, it's not a complete open yet, Mohit. So the offices are working at 20-25% staff.
Right.
The IT sector has 40% staff and things like that. So even then, there was a sudden movement and people started moving around because before a month, it was a strict lockdown, and a month ago, it started opening up. And what happened in this 1 month is the number of cases suddenly went up. At the same time, there was an increase in the number of testing also because more kits came in. The prices of the tests came down. But even then, since the number of cases went up suddenly in the last 3 weeks, I think that's what happened once the lockdown had opened up. So the health authorities wanted to open up things so that, the factory workers return to work, the shops start.
Yeah.
But they have seen that this has overwhelmed the system and they just want to take a break. And I think the rise is because people started moving out. The lockdown has served us well. The cases were definitely less. But now we are seeing that in India, if you see, there are approximately 28,000 cases per day. And out of that, 1/3 of the load is from Maharashtra, about 8,000 to 9,000 cases per day from Maharashtra itself. And Maharashtra tops the list, my state, in the number of positive cases being detected per day. And also, if you see the deaths which we've had, we've had about 22,000 deaths in India, a little more than that.
Right.
And out of that, 35 to 40%, 9,800 deaths have been from the state of Maharashtra. So these are the kind of figures we are looking at. They are a little scary.
Yeah.
And Maharashtra, Tamil Nadu, Gujarat, and Delhi. These are the four states which are having big numbers. And even Tamil Nadu has gone on a second lockdown.
Okay.
Gujarat is thinking about it. Pune, Thane, which are the major cities of Maharashtra, has gone on a lockdown. So it's a difficult situation, Mohit, to be honest.
Oh, absolutely. And I can't imagine, having come out of it and then seeing it rise again. I mean, this is a very, very different situation with respect to any infection. I can't imagine you've ever gone through this or something similar to this. So when you look at this, what do you see? So, okay, do you think 10 days is just the beginning of many more days? Is this one of those things where let's start with 10 days, but you have a perception that this won't be enough? You've been through a 40-day lockdown. You know what that feels like.
A little
What's
more
your
than that,
feeling?
sure.
Yeah.
So my feeling is let's see how this works. There
Yeah.
are various opinions, and I've been discussing this with the healthcare guys and
Yes.
the non-healthcare guys. I have friends from the industry, from the IT sector,
Right.
and they are saying this is not a good move
Okay.
because the economy is already hit, and
Yeah.
they've just about started working. They've started opening their companies. People are coming in, and they're, even though they're not really working 100%, but they were getting there. And this full lockdown is going to be a problem because whatever they started is going to shut down. The economy is going to go down further. So my non-medical friends feel that it's not a good idea to do that. Let it go. Let people live with it. It's not going to be a problem which can be solved in 10 days. But
Yes.
on the other side, which, and my personal opinion is that it's a good thing because it will just help the healthcare systems to revive a bit,
Yeah.
rather than things getting out of control and panic striking all over the city. Right now, it's still under control.
Yes.
People are finding it difficult to get beds, but they are getting a bed and getting
Yes.
admitted. But the situation can anytime just go out of control and be a bizarre situation. So I think this 10-day lockdown will help us, even though the economy is going to be hit.
So what happens again with your hospital system particularly? So are you a designated non-COVID center right now? And if you are,
So
or what happens with respect to your day-to-day life?
So for me, we are still not a COVID designated hospital, but the government has been talking to us.
Yes.
And anytime now, if the system further gets overwhelmed, we will have to convert our hospital to a
Okay.
COVID hospital. They have done a survey just yesterday. My CEO was at a meeting with the health authorities.
Yes.
They've calculated, but our being a pure orthopedic hospital, we don't have the number of physicians, the ventilators,
Right.
the kind of systems required. But we are gearing up, and we have completely closed down 2 floors right now because anyway there's no work.
Oh,
So
yeah.
we are getting ready, putting all the oxygen connections, and I don't think the day is far when we'll have to start admitting COVID patients in our pure orthopedic setup, because simply the system is overwhelmed and we need to do our bit for the patients of Pune.
And I mean, really, do you think that there's really going to be any shift in the way we think in 2020? So, for example, in the absence of a vaccine, Parag, I mean, it seems to me that we'll be going back and forth with various stringencies of lockdown or physical distancing policies. Do you think that's going to be the way 2020 will look now? Is this our path of 2020?
Yes, I think as per my calculations, this virus is not going to move away for at least another 6 months.
Yeah.
So 2020 is going to be that way because the way the cases are being seen in India, it's already the fourth largest hit country after USA, Brazil, and Russia.
Correct.
And it's going to continue, and more so because of the pure size of our population. 1.3 billion. That's what we are talking about. So
Yeah.
it's increasing. We have in Mumbai a place called Dharavi, which has it's the biggest slum in the whole of Asia. And the number, and these people really can't practice social distancing.
No.
They can't really, have all the, norms followed what has been set up. So the cases are going to go up. I think 2020 is going to be that way. We just have to stay put, take one day at a time,
Yeah.
help the government authorities in whatever way we can, follow the norms. What happens is that, I can just give an example. Since a lockdown was declared 2 days ago,
Right.
and since the grocery shops are going to be closed, suddenly there was a big lineup at the grocery stores, the supermarkets to buy stuff, petrol stations to fuel up, and then there's no social distancing there. whole, kind of the practices which we want to follow have gone for a toss for the COVID issue. And therefore, suddenly there may be a rise in other cases in 1 or 2 days because simply people have, forgotten what are the restrictions and precautions to take. So I don't know. It's a double-edged sword, let's see how it's more of an experiment. What
That
I was
is.
talking to some of the government authorities. Let's see if it works. Then in between we can
Keep
take
doing
this
that.
as like a 5-7 day break
Yeah.
and work, and then that can be the new normal. I don't
Understood.
know.
And
It's
and
it's a
and is this happening on Prague? And you may not know this, and but do you know who's getting infected at this point? Is it affecting anybody and everything? Anybody and everybody? Now we've heard, that it has affected some big stars, and that's going to shine even more light. We've heard Amitabh Bachchan and his
absolutely,
son are both in hospital,
absolutely.
so that news has gone very quickly to the Indian community and
Yes,
non-Indians
yes,
outside. But I have a perception that this isn't just about people in the slums getting
yeah,
infections. I think
yeah.
this is affecting everybody.
This is affecting everybody, and as you rightly said, our mega Bollywood star
Yeah,
Amitabh Bachchan tested positive, and his son too. Apparently, the story is their grandson, Amitabh Bachchan's grandson, was out for another party, and he came, and that's what
yeah,
he gave it to his
yeah.
grandfather. So this is going to affect everybody. We heard of many other. The Prime Minister of Britain itself got it.
Right, right.
So many big stars also
Yeah,
have got it. So it's not going to spare anybody. But you know, I generally feel that till now, what we have seen, the major sector which have got affected till now was more of the middle class and the lower middle class strata.
right.
But now it's also affecting the higher middle class and the higher class in terms of the economic class. So I think it's not going to spare anybody, and it's just about a little bit about your immunity. If your immunity is high, you probably remain asymptomatic, and if it's not good, it affects you, and then you have symptoms, and that's the way it's going at right now.
So let me ask you this then to close up here. On a personal note, how does the next 10 days look like for you again? Are you still going to be going into the hospital, or is this a full lockdown where you do not go, you do not
No.
leave your home?
So for me, I will be going every day to the hospital because we'll still have patients. Accidents still will be
Okay.
happening, and we still have patients coming in with dislocations,
Right.
fractures,
Right.
emergency cases, severe pain. So we will be there, and at the
Okay.
same time, we need to do our bit in terms of helping the government. So I'm going to also get into some of the government bodies with an active role for seeing what can be done best for our city. And the next 10 days don't look too good, but I just hope that our doubling time reduces the number of cases which we saw in Pune, 1800 per day. They go down, and maybe after 10 days we have a chat again, and hopefully I have a little smile on my face after 10 days. That's what
You
I
know,
hope.
I mean, it is a incredible period because what's happened, and I'll give you a sense of what in
Mm-hmm.
Canada. In Canada, Ontario province has 15 million people or so. There have
Okay.
been under 200 cases per day now for about several days. And there is a sense that, oh, okay, we're over this. And there's a big part of the community that is suggesting, we have won or close to have won, and let's reopen fully.
Mm-hmm.
There's another part of the community that says, let's be very, very careful because the minute we relax, the minute we let our guard down,
Mm-hmm.
we're going to start seeing increasing. And
This
that's
is
the
again
battle. That's the battle that's being happening.
battle.
And there are two sides to that battle. And you can see when you learn from everybody else that this is not something that you can completely eliminate. We saw in New Zealand,
Yeah.
0 cases, and then within 2 days, immigration or migration came in and they had more cases.
Yeah.
You know,
So
you're never really stuck. On that note,
So Mohit, before we close, just
yeah,
one quick question. Since
yeah,
you are interacting with many people, many
yes,
countries,
yeah,
what's your sense? When will the vaccine come in? And if it
yeah.
does come in, is it going to work? Or
Right.
what's your
No,
sense before we
yeah. So
close?
there are like double digit number of groups who have vaccines now in clinical trials, Parag. So that's a good
Mhm.
thing. The likelihood realistically of a vaccine coming out in 2020, if it does, it would be really wonderful. But you could see the latter part of 2020 a vaccine possibly being
Mhm.
said as being
Okay.
effective. If that's the case, the big push is how quickly can you get the vaccine in the hands and manufactured. So having something test as, oh, it's good and functions, is it months and months and months away from someone actually being able to use that vaccine and getting it out into the hands of the people who need it. So I suspect healthcare workers, a bunch of other people will get priorities to get immediately, right, to get it. But I don't think 2020 is seeing some cure. All the treatments, the 600 randomized trials that are currently being done, you've seen a handful of treatments. You've seen maybe high dose corticosteroids. You've heard of something, remdesivir. These are very, very small incremental benefits that you're seeing. And you're also seeing it in a very small group of people who are ventilated, for example. They're really, really sick.
Right.
But for the majority, there is no treatment. It's masks for all that you're seeing in many countries. Everyone wears a mask. That's it. And you can imagine that is that even remotely feasible in India for to tell every single member of the community you are to walk around with a mask outside or inside, sorry, and then distancing. That's it. So we really don't have a solution. That's the challenge we're all in.
Yeah, I think just take each day as it comes. Let's hope for the best. And
I know. Yeah, I mean, I just hope you get through these. I hope India gets through these next few days, and it does exactly what it's supposed to do. The mental part of just being in a lockdown, I think, is very, very fatiguing. I think for communities.
Yeah. And the initial 3 weeks were good. You were feeling nice. You have time, but now it's it's gloomy. It's not all that great to be in the
because you don't see a future. Because there is the risk, Parag, and I know that feeling is that they're saying 10 days. On the 9th day, they'll say it's not sorted. We need 5 more days. We need 5 more days, and that's the fear.
That's the fear that stresses you. Let's hope.
Let's hope
get better.
Yeah. Well, thank you so much for doing this on your day off, so to speak.
No,
I know there's no day off. I know.
But it's for you. It's for you early morning. But thanks for having me.
And we will definitely get this up and get it out to our community. And we'll be all thinking of you as you work your way through what seems to be a little bit of a tougher time right now. But thank you so much, Parag, for everything.